The TESTOPEL insertion procedure is office-based and usually takes 10 minutes or less. To achieve and sustain normal testosterone levels, TESTOPEL pellets will be inserted every 3 to 6 months. The pellets will completely dissolve. To get started, open the sterile TESTOPAK. Other than a sterile trocar and TESTOPEL pellets, the TESTOPAK includes everything you will need for the insertion procedure. Next, prepare the sterile trocar that has been provided with the TESTOPEL pellets. Break open the glass ampules containing the pellets, gently dropping the prescribed number into the sterilized cup. Insertion target area is the upper outer quadrant of the hip. Your patient can simply lower their clothing to expose the insertion area. Full clothing removal is not necessary. With sterile, gloved hands, cleanse the area with 2 of the TESTOPAK's betadine swabs. Place the fenestrated drape, revealing the area for insertion. Mark the anticipated trocar tract with the surgical marker if desired. Inject lidocaine 2% with epi for initial wheal formation at the insertion site. Then proceed to anesthetize straight down at the point where the trocar will be introduced, and at points along the full length of the anticipated trocar tract. Using the TESTOPAK's 3rd betadine swab, re-cleanse the insertion area. Make a small puncture with the 11-blade scalpel, inserting the blade straight down to the plastic tip. Insert the trocar with sharp-ended stylet, angling down at approximately 30 degrees and in line with the femur. Once you have reached the subcutaneous tissue, adjust slightly and flatten out the trocar, stopping to leave only the trocar well exposed. Remove the sharp-ended stylet and replace with the blunt stylet, leaving the trocar well exposed. Load TESTOPEL pellets into the trocar well using gloved fingers or TESTOPAK's sterile forceps. Advance the pellets into the tract with the blunt-ended stylet, while slowly withdrawing the trocar. Avoid having the final pellet too close to the initial puncture opening. No more than 6 pellets should be inserted per tract. In the event that more than one tract is needed, a V technique should be used. After the first tract of pellets is inserted, retract the trocar, leaving the tip in the subcutaneous tissue. Remove the blunt stylet from the trocar in order to reintroduce the sharp stylet and advance for new tract formation. Proceed with the second tract, forming a V shape. Once the trocar is completely withdrawn, cleanse the area with the included alcohol wipes. Apply steri-strips for closure and then cover with the enclosed 2x2 gauze, folded in half and secured by Tegaderm. Apply pressure and/or an ice pack to minimize any bruising. Patients may return to normal activity immediately. They should not swim or soak for 72 hours and should avoid strenuous exercise for 48 hours. Please counsel your patients on appropriate post-procedure care and the potential side effects associated with testosterone therapy. TESTOPEL pellets will then dissolve slowly over the next 3 to 6 months, elevating your patient's testosterone levels. TESTOPEL should not be used in men with breast cancer due to the potential for development of hypercalcemia, or in men with prostate cancer due to increased risk for the development of prostatic carcinoma. Patients should not use TESTOPEL if they have had a previous adverse reaction to TESTOPEL. TESTOPEL is not approved for use in women. Side effects reported with use of TESTOPEL include excessive frequency and duration of penile erections, hirsutism, increased serum cholesterol, acne, acceleration of bone maturation without compensatory gain and linear growth in children, male pattern baldness, alterations in liver function tests, suppression of clotting factors, polycythemia, increased or decreased libido, headache, anxiety, depression, and generalized paresthesia. Some men may have breast development, breast discomfort, edema, or prostate enlargement accompanied by difficulty urinating. TESTOPEL insertion may cause pain at the site of subcutaneous implantation of pellets and is rarely associated with anaphylactoid reactions. There is less flexibility for dosage adjustment compared to oral administration or intramuscular injection of oil solutions or aqueous suspension. Surgical removal may be required if testosterone therapy is discontinued. To learn more, visit testopel.com.